So my name's Gerard. I'm an orthopaedic surgeon. That means I'm a doctor who does operations on bones, joints and soft tissues. You'll have heard something about donating organs, things like your heart and your kidneys. Donating your bones and your soft tissues are also very important, and in fact bone is the second most commonly donated tissue after blood. In my job I see a number of people who are missing bone and soft tissues, and we need donated bone to make up for that. One of the most commonly performed operations in orthopaedic surgery is hip replacement. Hip replacement is a great operation if you have arthritis of the hip. It's an operation that can change your life, and for many people it does. In fact, for over 50,000 people a year in the United Kingdom, hip replacement changes their life. Unfortunately, occasionally hip replacements can wear out, and that means we need to do another operation. And when they wear out, some bone is lost, and we have to make up that bone with bone that's donated, either when people are having their hip replacement or after they die. This is a hip replacement. The hip is a ball and socket joint, and you can see here that this is an artificial ball, and it joins up with this socket which sits in where your hip is, which is here, and it's held in with cement. This hip replacement has been removed from somebody because it's failed, it's become loose, and you can see on the back of it, it's covered with cement, and that's how it's held in. So when this hip replacement was changed for another one, the hole that was left in the socket was filled with somebody else's bone. And that allows the person who's had a hip replacement that's failed to get a new hip and get back to doing normal things. It relieves their pain and allows them to get out of the house, go shopping, and so on. The other kind of patients I treat are patients with bone tumours. Bone tumours are malignant tumours or cancers, which can be very serious illnesses and often affect young people, teenagers or young adults. In the treatment of bone tumours, surgery is very important. And what you have to do as a surgeon is do an operation that involves removing that bit of the bone that has the tumour in it. Sometimes we replace this missing bit of bone with an implant like this. And this has been designed to replace the bottom end of the thigh bone in somebody who's had a primary bone tumour called an osteosarcoma. I'm pleased to be able to say, using this sort of technology, we can save somebody's leg in almost 9 out of 10 cases. However, sometimes the tumour doesn't come right down to the joint, but it comes close to it, and in that situation the best thing to replace the segment of bone is in fact another piece of bone. And in that situation it's very important to get donated bone so that we can cure that person of cancer. It's not only bones that we need to get people back on their feet. We can also use tendons and ligaments. This is a model which shows the Achilles tendon, which you can feel at the back of your heel. This is a very solid bit of tendon, and that's very useful to us as surgeons, particularly if you have a patient who has a problem with their Achilles tendon. You can use somebody else's tendon to reconstruct it, or you can use it in other situations in the body to reconstruct missing tendons. Although artificial substitutes are always being developed, particularly bone substitutes, we have a lot of bone substitutes available. At the present time there is nothing quite like human bone for reconstructing bony defects.